Everybody on vibrate.
Yes. There we go.
All right. You can call the meeting to order. Thank you everybody for coming. Andrew, anything you have before we...
I think we planned on today just going through the rest of the default budget. We also have the proposed budget. We're just making some last minute changes and we'll bring that back.
Okay.
Shall we start with the agencies then, what Lincoln County? Okay. So we have Northern Hearing Services. We have Jane McKay. If you'd like to come up and present, please. Thanks for asking me to talk with you tonight. It's actually really helpful to have a chance to sort of interact a little bit. So I'm sure most of you have a concept of what the Mental Health Center does. I'm not sure that most people understand that we're adequately funded because we bill Medicaid for services to people with lifelong, very, very serious mental illness, and most of those folks have Medicaid because they're not functioning well and they're not able to, earn an income from employment. So many of them have Medicaid. So that isn't the population we're asking you for money for. We're asking you for support for everybody else. So. We're the only entity in the community that sees everyone, all comers. We have a very generous sliding fee scale, which you probably saw in my packet. We see a lot of people who have insurance with high deductibles or have chosen not to buy their own health insurance in spite of penalty. We also see people who just have no insurance, especially young people who are just starting out. So despite the Affordable Care Act and despite improvements in Medicaid coverage, there were 223 people in the town of Littleton who came to us who did not have insurance. And they received 1,341 hours of service. Littleton is in a fortunate position in the sense that our main office is in Littleton, so Littleton residents obviously can pretty easily access our services. A lot of services we provide are actually not physically the old-fashioned, you come in for mental health therapy and you talk to a therapist for an hour. I mean, that's sort of not what we do very much anymore. A lot of our services are based in people's homes and in their community. For example, we're now using video with some of our clients so they can actually access us on their phone, which is really cool. So people who might have otherwise not been willing to come in because they were embarrassed or because they had no transportation or whatever, we're beginning to do some Zoom sessions with them. So there's that population, people who just need help, usually in a crisis. You don't usually call the local mental health center unless things are pretty rough. You might call a private therapist for treatment when you knew you needed it, but you weren't necessarily in a terrible crisis. But our population tends to be people who are on the lower socioeconomic side of things for the most part, and often by the time they come to us, things are in pretty bad straits. So we do a lot of work around short-term crisis management, and I guess my pitch to the town would be that service is really critical for keeping not only if you want to help the person who's receiving the service, but the whole community fabric. We're all made safer, and the community is stronger when people have access to treatment, people who really need it and might not otherwise, be the sort of person who's gonna call in a preventive way. I guess one last thing is that we're the people who go to Littleton Hospital as well as Cottage Hospital and Weeks Hospital when somebody appears there in a crisis. So, if you have a loved one who is suicidal and they go to the hospital because they don't know what else to do, and it's always us who goes in, either in person or via video, and 24/7. That service is backed up by a psychiatrist, and the person that is doing the service is a master's trained clinician. So that's a super expensive service for us to provide, and I think it's incredibly important to the community. We also, of course, are seeing a lot of substance use disorder folks, a lot of addicted people, and I think it's, we're one piece of trying to address that problem as well. So, questions? I don't know if I can.
And how much are you looking for?
Oh, I'm sorry. We're asking for $9,696, and the way we figured that amount was about 20 years ago. We based it on population, and now we have imposed level funding on ourselves for many, many years. So that rate has stayed the same.
And that's based on service population or actual time?
Population.
And you would ask that question from previous.
That's okay. And the theory behind that is that, the real cost for us is being available. I mean, we need to maintain a certain level of staffing and services, whether 5% of the population utilizes our service or 1% or 10%.
So what is your service area in general?
We serve 22 towns. White Mountain Mental Health, it's a little confusing. White Mountain Mental Health is my agency's name, but we're actually a location of Northern Human Services. And our service area for White Mountain Mental Health is the 22 towns in Upper Grafton and Lower Coos. So we go down to Piermont, we go to Waterville Valley, Warren, up to Lancaster. We have offices in Lancaster, Woodsville, and Lincoln, as well as Littleton.
And you probably go to every town meeting at this time, requesting money from all of those communities?
Yes, we ask money from all of our towns, and most years everyone contributes. It's based on population, so Littleton is asked the most, but you get by far the most service as well.
Jenny, you mentioned that you treat folks who have addiction or opioid issues.
Yes.
Do you anticipate any funding coming or additional funding coming from state, federal? Because we're hearing a lot in the news
Yes,
that
the big influx
things
of
are
money.
coming, and I think just recently that there was something
A big amount of money.
Yes, that was going to be coming.
We're
from
not
the
actually, we would love some of that money. Because we're a community mental health center, we're not a dedicated substance abuse treatment center. We're not in the pipeline for most of that money.
So you don't anticipate seeing any?
No, we don't anticipate. I mean, and I don't want to mislead you, most of the people we see, with opiate or other substance use disorders have a co-occurring mental illness. So we sort of don't have our shingle hung out that we will provide, that we're the go-to resource for outpatient treatment for a heroin addict, for example. We see many of those folks because often there's a complicating mental illness component, but we're not. If someone just had a substance abuse disorder problem by itself, we would be willing to see them, but it would be more than likely they would go to a substance use treatment agency like Friendship House.
Okay, thank you.
Yeah.
You said 223 are from Littleton,
Yes.
and are those individuals
Yes.
Or number of visits?
Those are people, and they receive 1,300 and whatever I said.
43.
1,341 hours of service.
So in effect, you're asking the town to fund about $50 per person who use your services.
That, maybe.
Yes, yeah. It's wrong numbers.
I wrote that down somewhere, but that sounds right, yes. Yeah,
About $10 a visit.
yes. Well, the total cost of serving those people, the number of people we served, I think that's written in the application. So the total cost to serve the Littleton residents was, it sounds ridiculous, but it was $219,924. And that's based on our full cost.
And you want about 5% of that.
So we're asking for $7.23 per hour for the services we provide. And it actually costs us about $164 an hour.
What would happen if you didn't provide these services?
If we didn't exist.
Yeah, what would happen to these people?
Well, I mean, Center for New Beginnings also does some charity care, so I think they would probably be completely overwhelmed. They're the only entity, they're the only other not-for-profit agency that provides mental health services on a, that you definitely could be served if you can't pay full fee. So I would assume all kinds of people just wouldn't seek treatment. Most of the people we see would never, ever, ever access a private therapist. They just wouldn't, it wouldn't be in their frame of reference, and they wouldn't have the resources. I really, I mean, having been in the mental health field for my whole life, I really believe that mental health is a huge and important component of overall health. And I think that if we don't provide health care, including mental health care, to people who are at the lower end of the ladder in terms of money and education, and that the whole community is at risk. I mean, I certainly am not inferring that people with mental illness are dangerous, because they're not. There's a lot of research that shows that people with mental illness are more likely to be victims rather than perpetrators. But I do think that when you do not treat mental illness, things happen like, kids are impacted because their parents are laying in the bedroom curled up in a fetal position instead of being out making supper. Substance abuse increases, absentee days from work increase. I think you'd be shocked if you really knew how many of the days that people call out of work are actually due to mental health or substance use disorder issues. So I feel like it's, I'm biased, but I feel like it's a huge component of keeping a community whole.
The actual rate though that you would charge for the 1,341 hours of service delivered at your full rate would actually be over $200,000.
It would be, yes. The full rate for an hour of therapy is $164. Okay. Do we ever collect that? Very seldom.
Okay. And your cost per hour though, how much?
$164. That's our cost.
That's what actually.
Yes. That's what it really costs.
Like heat, water, wages, retirement.
Psychiatrists are very expensive. The other issue for wages, I must be hitting my 10 minutes, but the other thing that's happened in the mental health field is that there are not enough people in the field, so we're having a huge issue with recruiting and retaining staff all over the country, but we're at a bigger disadvantage because we're in a rural area. So we're having to move our salaries up. Our salaries already don't compete with many other entities, and we don't pay as much as schools, we don't pay as much as community health centers, we don't pay as much as a lot of other people. But even with that, We're having, in fact, I've got a meeting next week about moving our clinician, that's somebody with a master's level, 2 years of experience and a license, moving those salaries up because we cannot possibly get people to come to work for us unless we pay somewhat competitive wages. So our cost keeps going up.
So, any other questions?
One quick one. The 223 from Littleton,
Yes?
is that actual Littleton residents? Or
Yes.
is that the number of people you see in Littleton?
No, those are Littleton.
Actual,
When
okay.
people sign in, they have to give their address, and
Okay.
these are Littleton residents.
All right.
Well, thank you so much.
Thank you so
It
much.
was very informative, thank you.
Thanks.
Thank you so
Appreciate
much.
it.
Thank you.
Yeah.
We now have, let's see, I want to get the right name here, the Grafton County Senior Services. Would you like to come on up and introduce yourselves? You can come on up. And I will let you all sit here. There's 4 of you, and I will move. Thank you.
Bob, I seem to remember you sitting on the other side of the table. Welcome back. And Mel, actually, we're not at the beginning. We have a new member of the committee, and Mel, we want to thank you. We know you've had long time interest in Littleton and participation, and we certainly want to welcome you on board.
Thank you.
My omission for not having mentioned that at the get-go.
Hi, my name is Kathleen Vasconcelos. I'm the Executive Director of the Grafton County Senior Citizens Council. With me is Carol Zangla. She's the Director of the Senior Center here in Littleton and an Associate Director of our agency. Bob Mew is Vice President of our Board of Directors and a volunteer with our Advisory Council at the Senior Center. And Allison Morgan, Director of Service Link of Grafton County. So I'll start with an overview of the agency and then give everyone a chance to talk within our allotted time. So our agency operates out of 10 locations around Grafton County. We have an administrative office in Lebanon. We have a service link office here in Littleton, and we have 8 senior centers, one of which is here in Littleton. Our request is for $35,000 for fiscal year 2019. The purpose of our agency is to develop, strengthen, and provide programs and services that support the health, dignity, and independence of older adults and adults with disabilities living in our communities. We offer services such as home-delivered meals, which you might know as Meals on Wheels. We have congregate meals in a dining setting at our senior center, so older adults can gather for meals and socialize with their peers. We have a bus that provides transportation to medical appointments, shopping and other errands, and activities and programs for socialization. And we have many other activities, and we have outreach workers who offer assistance as well. During fiscal year 2018, 792 older adults in your community, and that's more than half of Littleton residents over age 60, received services from our agency. In addition, 353 Littleton residents were assisted by ServiceLink. The cost to provide services for Littleton residents was over $416,000. So our request is 8% of that cost and 1% of our total agency budget. Our request last year was $34,000. So we've increased by $1,000, and that is due to the increase in services that we're providing. New Hampshire is one of the oldest states in the nation, and we're the fastest aging, and so the need is increasing and will continue to increase. And so with that, Carol can provide more detail about the services provided here in Littleton.
So I run the senior center in town. We do serve 8 other towns out of this building, but the numbers that I'm going to give you are strictly Littleton resident numbers. We're basically a community-oriented center that provides essential and non-essential services, although I don't really think any of them are non-essential, because if you're an older adult and you lose your independence, everything becomes essential. So we do have a Meals on Wheels program. We're currently serving 110 Littleton residents, and if you think about that, that's huge. That means there's probably somebody on your street or somebody you're related to that's receiving Meals on Wheels. And with that service, it's more than just nutrition. It's our volunteer drivers will bring in the mail, they'll hang Christmas wreaths, they'll take dogs out, they'll even clean cat litter boxes. But they also like bring us back information that the heat isn't on, or you know, any number of things that are reported to our social worker, who then follows up and takes care of those issues. So it's not just, you know, a quick in and out thing. It's something that really protects some of the older people that the only person they see maybe all week long is that delivery driver. So it's not just a nutrition program. But in our congregate dining room, that's very much a social opportunity for everybody. We did 10,000 Littleton meals last year in our dining room. It's always very busy. It's sometimes the only activity a person may have in, you know, in their little world, and it's great that there's a place that they can go and socialize and just feel that they have friends and families. And so many times in this area, you know, kids grow up and they move away and they don't come back, and then you've got older adults that don't have a network. We're their network, and that's so important to just overall health. It's just incredible. But we do have 2 buses in this area that take it's an on-demand service, so there's no fixed route. You just call in, and we'll take you to medical appointments, to hair appointments, very essential, shopping, anywhere you want. And there was a recent episode where we took a gentleman who was in his late 60s, and he wasn't in the greatest of health, but we took him out to visit his mom at Lafayette in the nursing home for 8 months before she passed away every day. So she wouldn't have seen her son in those last years, and he wouldn't have seen his mother. But those are things you don't even realize are happening when you see our bus go by. You know, it's so much more than just the transportation. You know, you have taxis, and you have, but this is a special service that older adults can feel like it's easy. They just call, they can get where they need to go. There's no explanations. It's just a wonderful service. And I'm so happy to be here talking to everybody tonight, but I really want to see you down there, maybe going on a Meals on Wheels route with us, maybe going on the bus with us, and we want you to see what we do, and we want you to see the community that we're serving. So please do stop down. But we also do a lot of activities, health and wellness, yoga, line dancing, Zumba, you know, of course, bingo and poker and cribbage and all those things are big. But we have 10 exercise equipment pieces that were donated from all over, 3 public computers with Wi-Fi and printing and copying, and all these things are accessible from usually before 6 in the morning till after 4 at night, Monday through Friday. We don't check IDs at the door, so if you come in and you need something, we're always there quick to provide it. And I think one of the things that we also do is we work with other agencies in the community so that we're not just doing what we're doing for our mission, but we're encompassing everybody. We've worked with Tri-County CAP, so we have fuel assistance coming out of our building across the Littleton office. So every Friday, they do fuel assistance out of our building. We've done, North Country Health Consortium has brought dental clinics in, SNAP has brought the food stamp program in. And these are services that are more accessible now to the older adults in the area than they ever were before, because it's a one-stop, and we'll pick you up in the bus and we'll bring you in, and you can just get everything you need at our center. We do internships with Littleton High School, and we're currently working with the fire chief to, if in an event of emergency, we would have our buses on demand for any emergency in the community. We are the fire evacuation site for River Glen next door. So we're just way more than a senior center that provides meals and nutrition. We're really a hub of this community. So that's another reason why I employ you to come down and see what we do. All of our services are by donation only, and so we don't turn anybody away. We don't have fees. And the reality is the older Americans in this area just are on fixed incomes, and some of them contribute, most of them can't. So to enable us to continue the service, we do need some excess help. Bob's going to address our volunteers.
Okay. We have a very talented and dedicated staff. Couldn't begin to carry out our essential functions without a very large core of volunteers, about 1,000 countywide. The Grafton County Senior Citizens Council is a lean organization. We have a volunteer volunteer to staff ratio of about 10 to 1. In Littleton, we have about 120 active volunteers. Many of them drive home-delivered meal greets and work in the kitchen and dining room. But a number of others fulfill roles such as reception, office support, data entry, managing classes and clubs, custodial support, gardening, miscellaneous maintenance activities, and fundraising activities. Each of our 8 senior centers has an advisory council, which typically meets about once a month, and then twice a year we have a plenary convening of all the advisory councils for lunch and a session at some central location. The functions of the advisory council vary to some degree from center to center based on the culture of the center. In Littleton, for example, the advisory council serves as a sounding board for the center director, provides informal oversight of financial operations, engages in planning and executing fundraisers, helps out at special meals such as Thanksgiving and barbecues, and we serve as Grafton County Senior Citizens Council ambassadors in the community and provide support for a variety of special projects.
And I will pass these around too. I don't know if people are familiar with ServiceLink. ServiceLink is the federally mandated program for the state in aging and disability resources, and we provide several different programs, and I was just going to talk a little bit about them quickly. So this first brochure is our overall services. We do a lot of information and referral, not only for the senior population, but for all populations. So if you are somebody who has a child that needs some special services, we will help find some services with you. Some of our biggest programs, I'm trying to keep it, is the Options Counseling Program. This program is dedicated to assist people who would otherwise go into a nursing home to remain in their home. We work with the state. We assist with the financial eligibility piece, which is a very long, cumbersome project. But what it will do is it will set up a medical evaluation and then help people get free services in their home for self-care, medication reconciliation. It does save the county quite a bit of money in the towns because these people, like I said, would be people who would otherwise have to go to a nursing home. We also provide this service for veterans with referrals through the White River Junction VA as well as the Manchester VA. We work closely with them to help establish a budget, which the VA supports to get services in their home, again, with the goal of keeping them independent. One of our programs is the Family Caregiver Program. These are small grants that we assist families with if you're caring for a spouse or a parent, an uncle, and anyone, or a friend. There are small financial grants to help with respite, to help with supplies. If you think diapers for children are expensive, it's almost as bad for adults that need them as well. So it's offering some assistance with that. One of the big things that we've been able to do in response to some of the opioid issues is we started a grandparent caregiver program. The caregivers, there's no financial eligibility for this program or for any of the ServiceLink programs, but if someone is a grandparent taking care of their grandchildren and the parent is absent from the home, we can provide grants to help with school supplies, clothing, daycare, summer camps, that type of thing to help out with that. I have nightmares of my 26-year-old living home, so I couldn't imagine having a 3 or 4-year-old in the house at this point in my life. But we're very excited about that program. We've been in touch with all the Littleton schools as well as most of the child care programs to let them know this program exists. So probably right now, our biggest program is Medicare. So right now, if you know anything, we are the only program that is called SHIP, State Health Insurance Program Certified. We are not backed by any insurance company. We don't receive any compensation from insurance companies. We're not even allowed to take pens from them because we want to stay totally independent. We have to take exams every year to understand the Medicare processes and what's being offered. Right now, it's open enrollment. This is the only time, if you're on Medicare, that you can change your Part B plan, which is your prescription plan. The scariest thing for people to go on Medicare is that you're making a choice for your life. You need one insurance forever. But with the Part D, the prescription plan, you can change once a year, and we encourage people to come in. It's only from October 15th to December 7th. And we, from just sitting down with people and reviewing their plans, we're able to help citizens of Grafton County save over $550,000 last year. In Littleton, we had one gentleman came in who had he's 84 and he is working at one of the fast food places because he only has an income of $770 a month, and he had to be put on a cancer med, which was $10,000 a month. And he said, I'm just gonna die, I can't afford to take it. So we were able to work with him, the doctor, Medicare, some of the insurance programs, as well as the low-income subsidies, and we were able to get his medication for free. So another person came in who had 27 medications, and it took us 4 days to go through all the different plans to find the best plan for him. The reason is that this is important for folks is that the insurance companies don't tell you if they're going to drop a medication. So people who are used to paying $2 or $4 for their medication, all of a sudden it's January and they're paying $400. So that's why this is a very important time for us in service. All of our programs again are free. We also provide some education in how to read your benefit plan, so to help with cutting down on Medicare fraud. So that's what we do on Monday. So.
Very interesting, very helpful.
This is a summary of what we did last year. And just, I'll leave these, we just have a few of these, but this was an insert in the Valley News over the summer, talking about all the things that we do, and it highlights Littleton as well as our other centers. So I'll just leave these here, and we're happy to take any questions.
So first, thank you for everything you do. We appreciate that also. If government's going to spend money, it's a more effective way of spending it than government trying to do it themselves. For sure.
Thank you for your support.
Yes.
Thank you for coming. Thanks. Thank you. Is that it? Any questions? Thank you very much.
Thank you.
Appreciate it. We have a Tri-County CAP, and we're going to hear from several people. Regan is trying to get here on time. He just sent me a text from Quinn Mountain about 5 minutes ago. So I'm not sure Regan's going to make it, but we can cover there. We can go on. I'm sure you can. Come on up. If he shows up at the end for an agency overview, that's great. But come on up and introduce yourselves. She just
Yes, it was.
So good.
I get the sense I haven't used for a few years. So, ladies.
Hi.
Who's whom?
You want me to go first? Sure. My name is Brenda Gagne. I'm the Transportation Director for Tri-County Transit. I'm here requesting funding to support our Tri-Town bus, which operates through the Littleton Whitefield-Lancaster corridor, as well as our door-to-door system and our long-distance medical system. When I was looking at reviewing the application that was sent in, I noticed there were a couple of facts and figures that were missing that I thought would be beneficial for the committee to be able to view as I spoke very briefly about them. The service we provide is a door-to-door service. That particular service operates mostly medical appointments. Last year in particular did only medical appointments because we had such a huge request. It takes patients to see doctors that are affiliated with Littleton Regional Healthcare. That can be at weeks, or it can be a mental health visit, or even up to LRH itself. That is one of the systems we operate. Of course, we operate the Tri-Town bus, which we did a little over 9,100 trips last year. A lot of the residents that we pick up in town on our route, for the most part, we're either taking them grocery shopping or we're taking them to work. We do a lot of deviating to get quite a few of our passengers to Lowe's and Home Depot for work. And of course, we swing through Walmart and Shaw's. We're not just shopping, but employees as well. We recently just added on a new stop at Lane House, which, holy cow, has that gone through the roof. It's become very popular, which is wonderful. It gives the seniors living there an option. Now they can get on a public transit route if they'd like and ride to Whitefield or Lancaster or even in and around Littleton. The other service we operate is our volunteer service that provides long-distance, non-emergency medical trips outside of our service area, say Dartmouth, White River Junction. We've gone to Portland, we have gone to Maine Med, Boston, wherever the trip is that the seniors need to take. But I should mention that particular service is open mostly for our seniors, but lately primarily to our veterans. We've been doing a lot of trips for our veterans to White River. A few to Manchester, but mostly White River is where they're going. We're working in conjunction with our partner transit agency in Vermont, RCT. They're going to be running their route back to Littleton again. So we're working with them right now to connect. Some of our passengers have needs to get into Vermont and White River beyond veteran services. So we decided to hook up again. We did about 7 or 8 years ago, and then unfortunately their funding got cut and couldn't meet our route anymore, but they're back on the road, so we're really happy to be working with them. It just gives people the opportunity to get outside of the local area if they have medical appointments. I'm happy to answer any questions you might have.
So Tri-County being Coos, Grafton, and Carroll?
Yes.
Completely?
Yes. For the most part, yes. We look at it this way. We go over to the state of New Hampshire, kind of put your hand about 2/3 the way down. That's our service area.
So do you work in cooperation with Grafton County Senior Services for some of the transportation?
We do.
How do you complement each other and sort of?
Very well. We get along fabulous. No, actually, what we do is Kathleen. Kathleen is the new director.
Yeah.
Forgive me. She just came on board. I've been so used to working with Roberta that new people. She sits on the RCC. For those who do not know that. That is the Regional Coordinating Council for Transportation. She sits on the council with me. And one of the things the council members do, and it's all transit providers, is work in coordination with one another. If she has a trip, a passenger, that she's unable to either provide the entire round trip or sometimes just a return trip, she'll give us a call. Same thing, we've had passengers that were in a certain place, and for whatever reason, unfortunately it happens where our bus may get a flat tire, we will call them and see if they'd be available to pick up our passenger. We do work well together. However, there is such a great need that's local that although we will help each other out when we can, we're
You're
both
not
fairly
providing
busy.
regular duplication of like
No,
transportation.
no. And a lot of the service that we do is not necessarily based just on seniors.
Right.
We serve elderly, disabled, general public, low income, TANF recipients, Medicaid recipients. We kind of run the whole gamut. We don't have a certain qualification to ride with us. Yes?
You have about 3,500 trips and 288 unduplicated. Expand on that.
Sure.
How do they relate to each other?
The $34.99 or 3,500 trips is total trips for Littleton residents. The 288 that you're seeing are unduplicated people. That means 288 individual Littleton residents is what we served for 3,500 trips. The newest numbers that I gave you is our Tri-Town bus, which unfortunately, because of some very strict rules, we're not allowed to ask them where they're going or where they're from because it's public transportation. So we don't include in that particular statistic a resident count with it because we're never really sure. But the number represents our door-to-door service that we're doing, as well as the long-distance medical. That is the town of Littleton only. And that is total trips and miles provided. The unduplicated number, I'll be honest with you, I know it's 26 or 27, but I can't tell you which one it is. But that was individuals in the town of Littleton that we served, and most of them were our veterans. Does that answer your question?
So you serve about 300 people using transportation from or to Littleton.
Yes, yes, yep, we do.
Do you charge anything? Do you take any, you ask if they're Medicare?
Our Tri-Town bus, we call it a flex route because we deviate up to a quarter of a mile for somebody who's unable to get to one of our stops. That is a $3 ride all day, as many times as you want. The door-to-door bus does not have a charge. It is free. The long-distance medical, we receive funding to provide that service. If people want to make a donation, we throw it right back in the pot and just keep providing more trips. But there is not a cost to our long-distance medical service, not for elderly or disabled.
Okay.
Yeah.
Why do you service veterans when the veterans have a DAV van in the local area?
Because quite often when the veterans have to go, it is too much on some of, I'll be perfectly honest with you, it's too much on a lot of them to have to wait 12 hours before they can come back home. When the DAV van picks up several different passengers all at one time, what they're doing is taking a group down, which is wonderful. They're taking a group down, but they're spending like 12 hours before they can come back while all of them get to see their doctor's appointments. The ones that we're providing service to that go beyond White River, some that are going to Manchester, we're taking them down and bringing them back because they're the frailest of the passengers we're transporting. And they can't do a 10-hour day and wait, until they can come back. It's just too much on them.
All right. And you're a nonprofit agency competing with a profit agency in town, which is Traveris. Traveris does medical runs.
They do.
Why do you need to do medical runs if they're here to do it?
Well, to be honest with you, they came in when the state of New Hampshire switched over their Medicaid system to a broker system. Although we do provide Medicaid transportation and have for quite a long time, they came in well after we were established here, and we're part of a social service agency, which is why some of our services are free. And not all our passengers are going for medical appointments. We do hairdressing or grocery shopping or social visits as well.
Okay. And isn't there another, besides the Tri-County bus service, isn't there another bus service that runs around this area?
Give me a second.
You got blue buses, right?
Yeah, blue and white now, yes.
Who's the red buses?
Oh, RCT?
That's RCT, yeah.
That's RCT Vermont.
So they come over here.
They are coming into Littleton, because we connect up with them.
Okay.
Yeah, they
St.
operate
John's
red
by
buses.
Littleton, they do.
Yep,
They go to
St. John's by Littleton.
Walmart, Shaw's.
they do. Yep,
From-
yep.
I have a staff member who lives in St. Johnsbury who takes that bus to
Oh,
my
does she?
office at the old hospital every morning.
All right, so moving forward, we have next one.
Yes, I'm Dawn Torrigo. I'm the Division Director of Prevention Services. I'm presenting two programs, Homeless Intervention and Prevention and the Support Center at Birch House. So I'll present the information for one and see if you have any questions. First,
Can I ask a question first? Hold it.
Yeah.
Birch House has already been here.
No,
No.
they have not, because it's through Tri-County Cap.
Yeah, that's right, okay. So Birch House itself has not been here. You covering Birch House?
Birch House and the Homeless Intervention and Prevention Program.
Okay. And you know, there's so many of these things you sent us. There were 5 Birch Houses. There was all kinds of this. I didn't see how much money you were asking for in transportation.
4,000.
Okay. All right, I'm sorry, go ahead.
That's okay. Homeless intervention and prevention programs work with with individuals who are experiencing homelessness or are in imminent danger of homelessness. We do that through outreach in the community. We are the point of contact for the 211 phone calls. We work very closely with your town welfare administrator when she has someone present. We're her first call. We're working with our local shelter, the Tyler Blaine House in Lancaster, and shelters across the state with other agencies. In this past fiscal year, we serviced 84 Littleton individuals for homeless outreach. That means we went out into the community to meet with them, or they were referred to us by SEAL or the police department or any other agency in the area. We also provided money to individuals for first month's rent and security deposit or rent arrearages. We have numerous grant programs that help us do that. In this past fiscal year, we provided cash assistance in the amount of, it was just over $11,000 to residents in Littleton. So all these services really do help reduce your costs for your direct or for your town welfare money. I think we work very closely with SEAL, and it's been a really great collaboration. We're requesting $5,000 for this program, which is level funded from last year.
The $11,000 was money paid for
Rent, security deposit, and that's sometimes first month's rent or rent arrearages.
Do you work with the school system? Do you ever
So-
get referrals from the school system?
We do. So every school in the state has a homeless liaison, so depending on where that school is, so we work with the homeless liaison at Littleton or Profile or Lisbon. I feel we get more calls from those individuals for our domestic violence program than we do for our homeless program.
Don, do you work with New Hampshire Catholic Charities, the local office? Because I know some of the things you mentioned, I hear that, you know, they do
We
some
do.
of the same kind of things.
Very often there is an individual who needs quite a bit of services, so we sort of wrap around and we collaborate. You know, we worked very closely with Christina Burton when she was at the Catholic Charities office. We've actually hired her to work at the support center. So between Christina, town welfare, you know, whoever we can, the Community Church of Franconia, whoever we can bring to the table so that we can collaborate on putting services and funding together for individuals.
Thank you.
I have here, and I'll pass these around. So this is, I just brought the Grafton County stats so you can see by town the outreach and then the different funding for rental assistance.
Dawn, it looked like you had 368 people in Grafton County, and if I calculated right, about 23 in Littleton, and I did that like you had 9 rent loans. Are those loans actual loans, and do you get them paid back?
So there's a couple of different programs. There is a loan where the individuals do enter into a contract to pay the loan back at a very reasonable, mostly it's $30 a month or something like that. If they default on that loan, the Fed ups the money to the landlord so that the landlord's not at risk. But, you know, we try to hold them accountable, but it doesn't always work out that way.
And
But
on eviction prevention, that's where you pay maybe a person's rent one time?
it depends on the situation. We can pay up to 6 months.
And the bed nights, you had 7 families for bed
At
nights?
the Tyler Blaine House.
And how long is a week, a month? It looks like it averaged 60 days for some
Yeah,
days.
it depends. I didn't bring the Tyler Blaine stats, which is unfortunate, but, you know, it could be 3 individuals who were there for a week, and so that's 21 bed nights. Or it could be 3 individuals who were there for 6 months. And so.
That's so that per bed night counts the people in one room.
In one,
So if you
in
have
one
3
bed.
people, 2 people in a bed, that's 2.
It's 1 person per bed. So if you have 1 person come in and they stay with us for a week,
So
7 bed nights. If they stay the full year, 365 bed nights. So that's how that is, and that's the stat we have to keep for our state funding.
So 23 families is what we served, what you served, is that correct? For Littleton?
For,
Littleton.
yes, well, here I have, we provided outreach to 84 individuals.
Right.
And then the loans, 9,
Right.
13,
Mhm.
16 individuals for loans and grants, and then 4 individuals we put up in a hotel room.
And outreach, that takes all kinds of forms, counseling,
All
things
it-
like
yes.
this, including hotel rooms, things like this.
Mhm.
Okay.
A lot of the outreach happens through, we receive emails from the 211, which is the call center in Concord. If someone presents or is homeless, they dial 211, and that person does the intake and refers them out to the area that they're coming from. We also entered into a memorandum of understanding with the Littleton PD this year, but I don't think we've used it yet, have we, Chief? No. So if someone presents at the police station homeless and we have a bed at the Tyler Blaine House, CAP will pick up the cost to transport them.
Hello, everybody. Let's, can we move on to the next topic? For our time. Go ahead.
All right, the support center at Birch House. So we are providing services to victims of domestic violence in northern Grafton County. Our catchment area is limited to 17 different towns in northern Grafton. This past year in Littleton, we provided services to 116 individuals. That's women and their children. So our total statistic for services was 554 individuals. We're asking for $3,080, which is level funded for the past 2 years. The funds for both of these programs, I did want to mention, we're required to come up with matching funds for our federal grants, 25%. We cannot use federal or state money for those matching funds. So this is where municipal funding and county funding comes in to help us support.
Okay, next. I guess that would be me. I'm here for the Energy Services Division. We do fuel and electrical assistance for your households. We are asking for $11,000. I believe, yeah, I heard that. I believe that is level funded
I think it is.
also from last year. For fuel assistance, last year we served 220 households for a dollar amount of $191,319. We served 12 households with weatherization, $49,871. And our food pantries were delivered $16,661 of that.
Was that all Littleton?
That is just Littleton. We serve out of the Grafton County. They serve all your towns, but we have outreach in Woodsville, Littleton, and the Ashland is the main office.
What type of due diligence do you do when someone comes and say they need assistance?
They have to go through, they sit with an intake person, which is what I do. I'm the manager of Coas County in the Berlin office. I'm just sitting in for Andrea. And so they sit with an intake person. We go over where they work, their energy services are provided after they prove 30 days of income. So, 2 bi-weekly checks, 4 weekly checks, whatever. Unemployment searches are done, landlord forms are asked for, tax returns are accounted for, food stamps, and if they don't have any of those things in place, then we refer them out. So I do work with this program, they refer in, we refer out. Just like ServiceLink. ServiceLink may take an application for us and then it comes in via email, and if all the information is there, we put it in the system and it's certified, and their letter of assistance either goes out for rent to, if their heat's included, it goes to a fuel vendor, which is state approved vendor list, or it goes to Eversource for electric heat. They can get fuel assistance and electrical assistance. It's right now, fuel assistance is open to the 60% median income, which has opened it up greatly for those like senior citizens who get that pension that we're missing it by $50, or so that income frame has gone up a lot, and so with that we're able to service more residents. The electrical is rate funded, so that remains at the 200% federal poverty guideline.
And what is the 200, what is that, the poverty guideline?
I don't have that with me, but I would say for one person, federal poverty guideline is $1,800, and a median income I think is around $2,700 a month. The electrical assistance, once you're approved, is a discount that runs the whole year until you come back. The fuel assistance, obviously, we're ramping up now. We're scheduled to open the first Monday of December, which is December 3rd. We'll run through April 30th. People can come in as an emergency. We'd rather they didn't. We have had them. We have a certain amount of time to deal with that emergency and make sure that they don't freeze. And
Is your assistance just per month and they come back and again, or do you?
No, it's a one-time, for fuel, it's a one-time shot. So say you made $2,700 income, you qualify.
For the month?
Yep, for the month. So you qualify for $525 of fuel, which is going to be granted to CM Brown. That may last you 1 or 2 fill-ups, whatever, but it's meant to be 1/3 of your annual calculated heating cost. And we do collect that from the vendor also. We collect how much you've used all year long, and it's all get entered into the program and calculated out to help us.
And when do they come off of it?
April 30th is the deadline.
Okay.
Yeah, December 3rd to April 30th. Very seldom any of those benefits go back into the pot. If they're not used by April 30th, it goes back. But it's there until from December 3rd to April 30th, which are your winter months for, say, Eversource or those type of situations is November 15th to April 1st. So we're just right around that figure. I was just the other side of it.
Now, fuel assistance is a state program, correct?
Fuel assistance is federally funded, yep.
Federally funded. So,
Feds give it to the state mandates it out, we are the carrier,
so
per se, of that
if the
program.
federal government's paying for this, why do you need $11,000?
Because we have, that money is spent directly for the client. That does not cover our costs for admin, the offices, the travel, whatever, paper, pencils, ink.
So you mean the oil itself, the federal government, is strictly for the clients?
Correct.
So our $11,000
Your
is paying your
11
salaries?
It's part of that, yeah.
Okay, it's not paying for fuel assistance as per se. It's not actually giving anybody any fuel.
Correct. We administer this. We administer that.
Who else in North Country provides fuel assistance? Is Tri-County Cap the only one that does fuel assistance?
Yes,
Okay.
yes. We partner up just like they do. If I have an emergency and I don't have a vendor that is going to be able to go out that day, or they don't have a vendor agreement or anything like that, or we're not open, we call Catholic Charities, we call Salvation Army. We do the whole pot thing just like everybody else does, so to make sure that the client gets what they need.
And how do you know that these clients aren't going to all three of these on their own?
Because they have to sign a release. They
To who?
may sign a release for us to call the other agencies.
And do you call the other agencies every time you get a client?
Absolutely, not every time. When we have an emergency, we do. Yep.
Okay.
Yep.
Can I just chime in as a former welfare administrator? I know that that's my first line of questioning to someone coming in looking for assistance. Have you applied with Tri-County CAP? They sign a release, and that would be my first phone call. So I think we all know we're all working together to make sure that there's no double dipping going on.
We even do that at the town level.
Yeah.
They have to provide all that information. I used to be the welfare officer here for I don't know how many years, quite a few years, working with SEAL. So yes, they have to provide all that information, and there are calls going out to make sure that it's verified.
So no frequent flyers.
Right.
Is there a grant match similar to how Birch House has for the?
Oh, that I don't know. Do you know that?
No, there's no specific match to that grant as far as I'm aware of, the federal light program.
This is Reading Pride, so he didn't have a chance to introduce himself. So.
Few people here know me already.
Any other questions? And we'll wrap it up here. Thank you very much for coming. We appreciate it. Thank you for your service.
Thank you for your service.
For the dentist.
And just to confirm, they presented together, but they're coming in with separate.
Four.
Yeah,
we're $22,000 already from Tri-County CAP.
Right. I think they're pretty level funded from last year.
Yes.
And last year they did ask for 4 warrant articles, I believe. I'll have to look on my. They were at one time considering just presenting 1 warrant article, which I had probably passed that information on to, but then they decided against that, and now they're going to do it the original way and ask for the warrant articles that they've done in the past, level funded. So, yes. Thank you.
Thank you very much.
Thank you very much.
That's my stuff. Good to see you. Take care.
How you say that? Good to see that.
We only ran over by 17 minutes.
I'm sorry.
That's pretty good, actually. I don't know what it is. And staying on postal schedule is pretty good for us.
So I too want to welcome Mel. I was going to do it after we got through the agencies, but welcome aboard, and Dan, it's always good to have fresh eyes, new blood. Thank you.
Andrew and Karen, Karen and Andrew.
Go ahead?
Yeah.
Okay. I know we need to go back and finish the default budget, and I'm talking much better today than I was last time. I see you all. So if you could pass this information around. I hope I made enough copies. This is some new legislation that came through. You may have to pass it around. In September, I learned of it, but it actually had been passed in July, June or July, and putting it together. It has to do with the default budget, and I think it's really important to talk with you about what it is. I'm not going to read word for word, because it would take a while. It's 5 pages long. The default budget in the past has always been the same amount as the previous budget, operating budget, plus or minus increases in debt, contracts, other obligations, items mandated by law, and they were reduced by one-time expenditures. That's very close to the same definition that we have now, with a few minor tweaks. Some of those tweaks is trying to be more specific to what is in the default budget, and how it's calculated. So, as part of this legislation that passed, some things are still easy. One-time payments, one-time items. Example, we wanted to buy a new copier for the office. That would be a one-time purchase. It's a one-time payment. Be taken out the next year. It would not be part of the default budget. Or we wanted to repair a truck that was going to cost us $50,000 to repair. The truck's worth $300,000, so we included it in the budget. In the proposed budget, it was approved by the voters, so that became part of the operating budget. And I'll use an example for 2008. In 2019, we take that $50,000 out of the default because it's a one-time expenditure. That really hasn't changed. Those items have not. What has changed is items like, and when you get into reading this, you'll read more detail. Example, the town entered into a lease in 2018. This is new. This is completely new. We haven't entered into a lease that wasn't approved by the voters, but had we entered into a lease that was not approved through a warrant article or part of last year's proposed budget, that could not be included in the default budget. So,
say that one more time.
it is hard to understand. If the town, even though we've got the ability to enter into leases, if we entered into a lease that either was not approved by a warrant article or wasn't part of last year's approved budget.
Something you did legally, but you weren't required to get town
We could
approval for
not
it.
include this in the default budget, just so you're aware. This is something that changed in all of this process for the town.
Yeah, not a situation we've normally been in, though.
Right, right. Some other items. A CBA, when you vote on that, you vote for the 3-year raise. And it's always included into the default budget and has been right along. If you did not vote on a raise for an individual, then that raise can't be included in the default budget. When you vote on the approved budget, and it includes the raises, the 3% raises that we have in there, that is included in the default budget. So there's a little bit of gray areas.
Okay, but normally, those raises are voted on in a warrant article.
Either warrant
with the
article.
union contract, right? And
Or the approved budget.
right, which would normally be non-union employees.
Right.
But once those are voted on,
Those are included into the default budget, okay? Anything beyond that, let's say my boss was so generous, he offered me a merit increase of $5,000 a year last year, and we cannot include that in the default budget.
okay, because that was done outside of the voting process.
Right.
Okay, so going back to salaries for the non-union. So normally we would have a 2-year contract for, the unions, or a 3-year. And you would assume that you could give that non-union employee a raise each one of those years, but you can't now.
We haven't done, because as I've always presented to you, the default budget does not include any increase on the non-union employees.
Okay.
That's how we've always presented that, and that's how it is this year.
Okay.
In the default budget.
In the default budget.
default
So
budget.
we have not done anything different. We're not at this point doing anything different than what we've always done. But other entities may have. And I just wanted to get it clear so we understood what was here, what was happening. Some other items that have come up in this new change is if a position is eliminated. So a position is eliminated in 2019, and we kept it in the default budget, we cannot do that anymore. It would have to be eliminated in the default budget as well.
That normally happens anyway.
It would, but I want to make it clear that that's things that are happening. If a position is vacant, we have not hired somebody yet, we plan to hire somebody, that can be kept in the default budget, and it's, of course, in the proposed budget. But, and I'll throw out an example, our Public Works Director. We have not hired for that position yet. We do plan on, I hope, this week, having an answer from somebody for that position. So we have included that into the default budget and the proposed budget.
But if you had eliminated that position earlier in the year or the previous year?
If we eliminated it this year,
you can't just
we can't
keep it in the
include
default.
it in the default budget.
So
Why would you?
To keep the budget number up, I imagine.
Okay.
I mean, we don't, I don't,
It's nothing you would normally do, it's
Yeah.
just avoiding sort of
I think that's a
flopping the
lot of
budget.
these changes don't really impact us because we weren't
do it.
doing any of these
Yeah.
anyway, so.
But how would you eliminate the position? By vote of selectmen?
I can just eliminate.
Or
He has the
administrative
authority.
decision? Okay, but somehow it's written down,
Yeah.
such and such a day I've decided to eliminate this position. So if that, once that happens, then it can't roll forward into the next year's budget.
Right.
Okay, so I mean,
Yeah, so if there was no posting for for the position that was being filled, I mean. that would be-
yeah, but that's
We
different
could
from,
potentially make a case for that. right?
Yeah, but you posted all positions that need to be filled, so you're carrying the line for that position.
So
So it sounds like it's covered.
I just want you to
Yeah, we're good.
go
Yeah.
through this,
Yeah.
make sure if you have any questions, either you can email Diane or Heather and they can get the questions to me, or
but if in the budget we had $100,000 for heating and fuel, and the heating fuel was $2 a gallon, and heating oil goes up to $3 a gallon, you still, in the default budget, just have $100,000.
correct.
That
was the
has to
question
change.
that's
And that's
come up.
probably the one item that we've had more than anything else, it had to do with per gallon or total.
Am I incorrect? Did last week you talked about a position that, I don't know if we hadn't hired it yet, we were going to hire, but in the default budget, we increased the hours?
Correct.
How does that look?
Well,
And what position was it?
it was in the executive budget.
Okay.
And in the executive budget, we have one person that's going from 40 hours a week to 32 hours a week. We had one position that was 20 hours a week that we budgeted for 32 hours a week. So it's just kind of evening out. We also had, example, my position. We had my assistant, which will be taking over HR. My position is actually dollar-wise getting reduced. The other individuals that are coming into or working for my department are going to work 32 hours a week. The total dollar-wise for wages and benefits is not changing.
I totally understand that. However, with the new guidelines, you're still okay.
I believe we're okay. Now, this is why I wanted to bring this to you, because if I find something, Andrew finds something through the default budget that we have a question on, we're not quite positive, or if any of you do, and we can't answer that, we will go forward and get the answer
Will
on
you
it.
verify that?
Yes.
Because, I mean, it's not that I don't want you to be able to do it. It's just that we need to do everything correctly.
And that's just basically the question as to whether or not you go into default or proposed.
Right.
Now, if I didn't change and I didn't retire,
You're fine.
or didn't cut my hours, restructure what I'm doing, the default budget could end up higher because of that if I waited till next year and got done.
I'm just
So there's
saying
some
that
things
we
that-
set a precedence too when we do certain things, so we just want to do things correctly at the very beginning. And I understand you're going down, but it is two different positions, so because it is two different positions, we need to find out how we can.
I'm gonna make sure, whatever we do, that I want you aware that this is out there, and if we do pick up something, the default numbers may be adjusted. Do I think they're gonna adjust up? No. I think if anything, they would go down. So there is a couple other things in here that I can see that we may need to adjust accordingly. Like one example of a contract. So this is a good example for the sewer contract. We hire out for the plant to be operated by vendor. This vendor has in their contract that they're going to be this rate this year, this rate this year, this rate this year. We can only include in the default the number that was in the previous year. We can include in the proposed that increase. If the default passes, it doesn't mean the selectman or the town manager don't pay that contract. It means the money comes from other areas of the budget.
You have to find it somewhere else.
Yes. So anywhere where I have a contractual increase in the default budget is going to have to be readjusted to make sure that we are not breaking these new rules.
But it depends on how the contract was approved.
Yes. But it does spell it out in here about those type of things.
So you would put the contract increase in the proposed?
I put the contract increase in the proposed. Now, if we were up for a renewal on a contract, the best way to do it to make sure that we can always include it in the default is have it on a warrant article. And you have the new amount for that year, the amount the next year, and the amount the next year after that. And that explains all about this in this
And if that
question and answer.
warrant article isn't passed, then you're back to doing
We,
signing it and then taking, or
we may have
shifting money
to,
around.
yeah, we may have to shift money around.
That's the
Okay.
whole issue. We just
Sure.
talked to the superintendent this morning about that, and this is gonna be totally different, present totally different things for the default budget. And part of the concern is that the default budget is so much lower than the proposed budget that people will vote for the default budget. In the past, the default budget has been like maybe a little bit above or just a little bit below, but never significant. And a lot of people in the community have always thought that that was a little different. It wasn't meant to be just so even. So it is going to take a lot of salesmanship, presentation, information, all of that to provide enough information for the people to really consider what they're voting for.
It also will mean if some of this is found that we need to pull some of the things in here out, we may need to have warrant articles, which could extend our warrant.
Are we going to surpass 75 warrant articles?
Seems like it now.
If you read this through, it very well could
Wanted
be.
to try to reduce, like, for example, start having vehicles or other items, smaller items, part of our operating budget, you know. We may have to have all warrant articles for all of those things.
Yeah.
You know.
I mean, can you lump things together, so sewer, all sewer, I guess it fails.
The danger is no
The
means
danger
no.
is, yeah.
And
That
then,
everything fails.
you know,
Are we gonna
then
stop running the sewer
Then
plant?
the
No,
EPA
I mean,
can
that'll
step
probably
in or-
take
yeah.
help with it.
I'm only kidding.
I
get it.
question the legislators in this. Seems
Yeah.
there could increase costs with contracts.
Like
In the long
anything,
run.
or
You did question them already? Or?
No, I haven't. I went to a presentation, the NHMA had a budget training session. There was lots of questions, but
like anything, anything, you think what you're asking for is gonna play out this way, and then it usually plays out some other way.
Yeah.
And you have to
But
make
up until
adjustments.
now, I mean, there's been a lot of discretion on the part of the selectmen. I mean, if the selectmen voted, said that this will be in the default budget, in most cases, there was very little questioning of that. So that's taking away some of the finality, if you would, of their decision, that they can't override this, so to speak, can't countermand it?
I will read you a short little piece of this. On the page 5 of 5, it does talk about what additional disclosures to the public are required. Again, the default is to be disclosed at the first budget hearing. Then if you go down to the last question, since the default budget cannot be amended by the voter, is it off limits for discussion at the deliberative session? It is now allowed, expressly permitted, or permit voters to discuss and debate the default budget along with other articles on the warrant. That being said, and it spells out the RSA, still prohibits the voters from amending the default budget at the deliberative session. So they can still discuss
So if
it.
somebody wanted to contest what was in the default budget, it can be discussed, but no action can be taken.
Just worried about voter fatigue if there's so many warrant articles. How do you keep track of them all? Just make an informed decision, other than watching Channel 2.
Well,
Whoever's
that's
calling
31.
now. Whoever's calling now.
Granite State TV.
That's all, I just, if we.
Well, I've always had that question, you know, that we've had so many, and if you just place them on there and let the voters decide, which is nice and on one hand, but on the other hand, sometimes the voters aren't tallying it up to see what the tax bill will be. So it's always been that yin yang, and we're gonna have more of it, I guess, so.
So you will see some changes, I believe, in the default budget where I put in contractual increases for different contracts. Andrew and I really need to sit down and weed some of those out. And we also need to make sure that we're asking questions because we don't want to shortchange what we're doing and what agreements we sign, because some of those could cause legal consequences.
So you both have been to some sort of workshop on this.
And I told you when we very first started talking budget about a month ago or so, that I would be bringing some information to you to talk about so that you'll have a little bit more information. And that's a piece of it. So we can get to the default budget where we were at. These are this new packet. I'd rather not give out right now unless somebody doesn't have their default budget with them.
Is it different from the one you gave us last week?
No.
Oh,
I got one here, an extra one, and we can give. These will be handed out toward the end of the meeting. These are the reviewed budgets by the selectmen. So this includes the proposed budget and the draft default again. The same numbers that we've been discussing, only with the proposed budget in here. And that's for next meeting to go through.
It's good to have it early.
Yes. So we were on the fire department.
And that's page,
21 of 46. Yours might be a little bit different. Okay. All right. In the default budget, the only increases in here were the ones that were through the CBA and the increase that was given to the non-union last year. So if you come down to health insurance, the health insurance has a slight increase, and that's because of plan changes. You continue on to the default, there is a reduction in the New Hampshire retirement system rate amount because there was a reduction in the fire department's rate. So this affected the budget here. The training uniforms in the default, I'll stay the same. The emergency reporting contract, this is one of those items that I need to verify regarding the new default changes. We added the dispatch service. Again, this is one of those items that I'll need to check into what we're going to do about.
And what dispatch service is that thing?
It's a similar to what the police have for dispatch. I think my understanding, it makes calls faster. I really can't tell you the details. The chief would have to.
what line is that?
I'm on page 23 now.
Okay.
A couple of yours might be a little different. It's under telephone and communications. So it would be the fire department's budget, line 15, on the left-hand side of the budget. No other changes all the way down through. We continue on. There's no other changes on the next page. Right down to the last page. The difference between 2019 default and 2018 approved is $6,542. It's a 0.60% increase.
Where do you see that?
It's on the last page of the fire department's
Yeah.
budget, which my pages is 24 of 46.
Okay.
It's in the middle column on the very end.
That's all right. Mine didn't print.
I'm sorry.
That's right.
Public Works Administration. This is a comparison between 2019 default and 2018 approved. This includes the change in staff, the plan changes on health-related insurance, and any other wage-related change. There's an increase in this line of $27,165. A majority of that increase is made up of the health insurance.
Can I ask you a quick question? We're in negotiations this year for the union, right?
For the union, yes.
For Public Works, Fire Department. So you got the increases in here for wages?
What page
in
are
the
you
default?
on?
Well, any of the Public Works default.
See, last year's Public Works, their increase would have only been for 9 months. So this year I have.
That's not the question.
Okay.
The question I got is, you got an increase in here for these people. But when they negotiate a new contract, they're gonna come up with a new contract wage increases.
And that's going to be effective April 1st.
Okay, but what happens to these? Do these get brought back to the proposed instead of the default? You're showing wages in here,
So
they're gonna start when?
I think what your question is, that these are from a previous agreement that we're still within the scope of, and that the new agreement will be for a new period, so these budgeted figures are.
Okay,
still
so
for that.
these, if there's any increases in here at all, it was still part of their old agreement.
Right.
They don't automatically jump up 3% every year.
Right,
No.
okay, correct, yep.
All right.
And Karen, you said it would only be for the first 3 months of the year, right?
Their wage in here
Yes.
is for the whole year at their current rate.
Okay.
So if an agreement wasn't reached,
If an agreement wasn't reached, this is what they would get. If there's an agreement reached, that piece of their wages is included in that warrant article.
No, we have to approve it first
Yes.
before it can be.
Right, and so that warrant article, even though it'll be passed in March, if you would, or voted on in March, will be retroactive to the 1st
No.
of January? No.
April 1st,
April 1st. Okay, so for the first 3 months of,
they're at their base rate, whatever their base rate is.
okay, right, but whatever the increase was in the third year of the contract, if you would, goes through the end of March of 2019.
that's correct.
So on to the public works. At this current time, we have some staffing changes in here. We have currently a public works manager. That was our former foreman. We have an acting foreman or interim foreman at this time. We are going through a few different adjustments in the staffing at the highway department. So we had an employee that was approved in 2017 that's in this budget. We had an employee that was approved in 2018 added to this budget. We have not hired that person yet.
And we're still considering a public works department head?
Most of these employees are 32 hours, 40 hours.
These employees are 40 hours a week. These are the highway, public works, garage.
That does not include any overtime?
The overtime has a
Okay,
calculation in here.
Oh, I
It's a
see it,
line.
yeah.
It's the same as last
Yeah.
year. There is a change in the health insurance. We have plan changes. And those you have absolutely no control over. Somebody could leave that is a single and somebody comes in as a family.
Actually, we have more families. Okay.
And then, of course, the different numbers related to the wages is calculated down through here. In the CBA, we do have uniforms. We have to include the new uniform for the new employee that was hired on. Telephone communications, the rest of these lines on page 28 have not changed from the default from last year's approved. And on page 29, the same. Page 30 is the same. There is a difference of $129,458 in the Public Works Department. It's 11.75% increase.
And that one is so much higher than the previous ones because?
You have one new full-time employee, and we've adjusted a position of the Public Works Manager, which is a person supervisor. Do you remember years ago, we had Larry Jackson, we had a Public Works Director, and we had a foreman. And then we had, when the Public Works Director left, we had Larry Jackson, which was the Public Works Supervisor and Manager, Foreman, working foreman. We're trying to go back to some of that setup.
So does that affect the new legislation?
It does, and that's something we have to talk about.
Okay. Quick question. So the Public Works Manager says the approved, 2018 approved. Where was that? It says 0.
There was no one in that position.
But where that person was somewhere else, right?
Yeah, they were foreman.
They were a foreman.
So then.
We've had people step up.
Okay.
You know, through.
Okay.
But if we hire a new department head, will there be a rollback there? Or
There could be.
Could be, depending on how.
Yeah, we want to get the person in and work with them to make adjustments that are most efficient, and rather than, trying to do it before they get here.
Yeah.
How long has it been since we've had a public works manager?
The director, we've...
Manager.
Yeah.
Title manager.
Oh, manager, yeah.
We have not had a manager for probably and I'm thinking off the top of my head, so please don't hold it to me, probably 10 years.
And all of a sudden we need one?
We're not definite on it yet.
Yeah, but this was a temporary, basically this was to fill in while we were reconsidering the department head, correct? I mean, basically, you need to have somebody in a position of authority, at least on an interim basis, right, is what it.
And the person that we're looking at as a public works director also has engineering background, which may help with many of our projects that we have to hire out for. So there
Which we had done that one time in the past with Kathy Hunway.
Right.
Yes, yeah, several times in the past.
And actually Bob Pantel, where we had an engineer.
And again, this has to do with the growth of the town.
Absolutely, and you know, one of the things that we want to try to do is do a better job planning so that we can have stabilization of the tax rate. So
We've been hearing that for years.
Well, it's happened not since I've been here, so yeah.
You're hearing it again.
You're hearing it again.
I know, but I'm just all of a sudden wondering why we need a public works manager when we haven't had one for 10 years.
Yeah,
It doesn't make sense.
Well, we
You've been running fine without one.
It depends on your definition of fine, and if you like to be proactive, which is very cost-effective, or reactive. And I think that we've been reactive for a long time. And part of my goal, and you know, you can't do it all at once, is to try to get the town in a place where, it's no surprise what's coming up even 3 years from now or 4 years from now, and all of our projects are as aligned as possible. And I think that I've been trying to pick up maybe too much public work slack myself, including town planning, and I can't keep doing it. I'm working with numerous engineering firms and trying to line up everything, all of the sewer projects, all the road projects with different pieces of equipment that we have. And then also this will be my third public works director, and I've been here for 3 years, so we've been burning them out. And when you talk to them after, you can find out we're really putting way too much on their plate. So,
But we've heard that from every department, so now we're seeing every department having all these high-priced positions come into them. Parks and Recreation Director.
yeah, take a look at the revenues too. You'll see,
Right.
you're gonna see, this is a growing community, and you're gonna see that we are bringing in higher caliber people any chance we get, but they're also gonna be results driven. So, if you look at, for example, the two places recently with changes that you see immediate impact are the Opera House and Parks and Rec. The programs are expanding, the revenues are increasing. If there's an increase in staffing, that means that there's an increase in the program revenues as well. And we want to try to.
I think we had some cuts though, whenever we had the big cut. And some of the staffing and a lot of the departments were reduced, and we just never caught up. And now
Yeah, but aren't you afraid of that happening again at one of these budget meetings? Because that happened a few years ago when people thought this town was increasing too fast on its budget and its positions. And now we're seeing that all over again. So the town can come back and say, that's it, we're cutting everything.
Well, I understand what you're saying, but I also think that we have to take a look and see if it was working. And we have to rely on people to say whether it's not working or isn't. You can ask more questions to have them basically really convince you that it is needed. But we have to also weigh both sides.
And the point that you raised about Parks and Rec and the Opera House, that those additional revenues are offsetting their salaries at some point, or some of the additional expenses. So it's not a one-to-one. Well, they are. They are.
They're not yet.
Yeah.
Well, they are currently. I mean, we've got with the Opera House, and you're bringing a lot more revenue and a lot more activity. And the whole experience of people using that facility is being elevated because you're getting better quality management and response times for revenue.
Then you would think that you would see significant reductions in your tax rate.
Well,
not based on assessment, but based on the fact that we should be looking at a zero budget, same as exactly last year, and it should not have any increases in it. When you put a $53,000 increase in there, 11% for one department, that's a huge increase for one department. 11% a year.
Well, and Ralph, to Ralph's point too, I think it is a real concern. That's something that we need to be really mindful of. and doing our job to help educate the voters to understand where things are at. And, you know, it would be great not just to be at zero, but to really be able to reduce the budget, or, you know, maybe through increased revenues. I mean, it's difficult. The economy's doing really well, and I think that almost any business that I speak to, you know, they have significant cost increases this year, whether it be personnel, you know, just even recruiting personnel, or, you know, getting the raw materials they need. And it's no different for government. And in fact, I'd say it's even a little bit more difficult because, you know, if you're a corporation, you're making decisions on, you know, how best to get profit. And you cut out a service or a good that's not performing. But we are statutorily required to take the crap out of your house, and you know, take trash and provide police protection or fire suppression protection, or keep your streets plowed. And you know, we have to do those. And so, like, if we don't get a truck that we need, you know, that may be an even greater expense if we have to go out and then lease a truck. And it's just we're constrained, and we're going to run as efficiently as possible, but I think, like what Ralph's saying, we're going to try to educate the public the best we can so that we don't end up with what I think it was 2011 maybe, or 2000, when the big cut happened.
1929.
Oh, yeah, 1929.
Yeah, the turnover itself is expensive.
It is.
If you get that much turnover in a department, you're not
Something's
doing
not working
anything
right.
proactively, and all your expenses go up.
And I think there's a tipping point. You invest in something and you're not going to get the payback immediately. It takes a few years to get the payback. So I think sometimes we have to say, and I agree, we have to make sure that we are going forward and upward, and things are increasing, the services are better. So I agree, but I think we also have to.
We also heard Tri-County Cap say tonight that they've got so many more seniors coming in on fixed incomes that are asking for services and asking for fuel and asking for everything because they can't afford the town at this point. They've got to go for services and whatever they get for free. So this is a town of senior citizens, a lot of them, based on fixed incomes. And we got to keep them in mind. That's always been my goal, to keep them in mind, because I'm one of them. So that's why I'm so particular about seeing a $53,000 increase when we haven't had to do it for 10 years. That makes no sense to me.
I understand. I think there's a balance.
And I like Ralph's sharp pencil. Keep it sharp, Ralph. But also, let us say this. Now, just so you all know, when we had that cut of $1 million some years ago, we saw $1 million in reduced services, but we only saw $700,000 in reduced taxes. Us, because $300,000 were paid by national corporations. So we may reduce the budget by $1 million, and we see $1 million in services taken out, but we don't see $1 million in taxes taken out from us local, from individuals, because of the dam and other things like that.
All right, moving on.
So the other line that changes on this is the health insurance line, again adjusting for different plans. Continuing on to page 28, we have some different amounts throughout the wage-related benefits. We have a uniform added for the additional staff because of CBAs. No other changes down through. No other changes down through the next page. And again, to the end of the page, I've already explained the difference. Under bridges and sidewalks, there's no change there. Street lighting and hydrants, in the default, there's no changes, even though I'm aware of 11% increase in electricity. Animal control, there is no changes. Welfare, there is no changes. Patriotic purposes, there's no changes. And Conservation Commission, there's no changes in the default budget. Under transfer station, we do have some changes in the revenue. There is a reduction in the revenue, which changes the amount that's coming from the tax appropriation. There is no changes in staff other than those CBA and raises from the previous year. No changes all the way down that entire budget until you get to workers' comp. There's a 3.5% increase. No changes until you get to the property liability insurance, and that's a 6% increase. So this budget has increased expense-wise $2,034. It's 0.53% increase on the expense. But because the revenues are down, we look at page 34, the amount needed from the tax appropriation is $20,804 more. It's 19.58%.
So that will be explained at some time, not at this time, but when they come in.
Yes.
For the department.
And the markets are looked at daily. Library, actually there's a reduction in this. They do have some added income, which helps reduce the amount from the tax appropriation. They have a reduction of $4,765. They did have an increase in their workers' comp and their property liability. They have a decrease because of plan changes in their health insurance. Parks and Rec, there is revenue adjustments all the way down through. So there is a slight reduction in their revenues for 2019 default. The amount that's coming from the tax appropriation is an increase of $17,163. It's a 6.68%. We have some staff changes. We have a full year of the Parks and Rec director. Last year we only had that in for, I believe it was 9 months. We didn't end up hiring till later on. We have some temporary positions that have changed around. We have added part-time building maintenance person helping year-round. We have a slight change in the health insurance. We have the increase in workers' comp, the increase in property liability insurance. The difference between 2019 default and 2018 approved is $12,712. It's a 3.26% increase. If you flip back to page 38, you'll see that the amount from taxes has increased because the revenue estimates for next year have some adjustments within them.
Now, what else did we have to do last year at town meeting with regards to parks and transfer station?
Transfer station, parking meters, and opera house will have to be on separate warrant articles.
But what was the deal that the state of New Hampshire threw at us midstream about that? Wouldn't it be designated them incorrectly?
They're considered special revenue funds.
And not
part of the operating budget. So we need to do some breakouts of those different budgets. I've included them just like I normally would have in.
But the question last year was if those articles hadn't passed, would you have had no transfer station and no parks department?
We could have. We could have ended up with that.
So is there a means of addressing that?
I'm hoping that we won't be able to have, just like we do for the operating budget, a line that shows you what the default is and what the proposed is for each one of those budgets. Last year.
But they don't start from ground zero?
They don't start from ground
zero.
But
last year they started from ground zero.
They did because they were never set up as separate warrant articles.
Which perplexed the hell out of me. I mean, how the state of New Hampshire, I mean, somebody all of a sudden said, geez, I mean.
I feel like in an effort maybe to create what seems to be greater visibility, may have kind of created one.
Well, so we're not at total risk now because we've made it through that year, but I mean, last year it could have been catastrophic.
Is it proper, I have a question on 38, y'all may have discussed before. why the revenue is down? We discussed it, nobody's voted for me.
Well, Brian will have that when you're talking about on the recycling center?
But no, the Parks and Recreation.
Why it's down in the.
We will have the
default.
Parks and Recreation Department here at some one of your
It's
meetings
fine, press on.
where we will discuss that. Debt service. So in your default budget are some of the new added items from 2018 warrant articles. The sidewalk plow sander tractor. The Foster Hill road improvements is in here. We paid in full a loader and a sidewalk tractor that's been paid off. We start the, actually that was started in 2018, excuse me. We have some estimates here again, and until we get signed paperwork, I'm just plugging in an estimate based on what I'm hearing for rates for both of those loans. So there is an increase in the debt service. A majority of this increase, it's $62,675, is from the Foster Hill warrant article. That was going to be paid at $100,000 a year over the next 5 years. We normally do not do road improvements that way unless we do a huge project like we did with, I believe it was sidewalks for Grove Street and numerous other streets. That was a $1.3 million project.
That covered 11 neighborhoods, by the way.
Foster Hill is now
Completed.
Done, yeah.
end to end?
I know the marker that it stopped at, which highway comes in, like the exact location.
But last year we talked, a
Yeah.
couple of them, they said doing half or something, but we ended
Yeah,
up
I think
doing
it
the.
was almost the complete road.
Yeah, almost completely, yeah. So, yep.
Okay.
It's a beautiful road if you want to take a drive.
So this is a 5.55% increase. Opera House, okay, in your revenues, you'll see some of the numbers are the same as last year, or all of the numbers are the same as last year. There is an increase from the tax appropriation of $4,049. It's an 8% increase from last year's. We do have the wages here for the individuals that are working now at the Opera House. We've had some great success there. Social Security, Medicare, of course, is wage related. Electricity, heating, water, sewers, all the same. Communications, telemarketing. We have workers' compensation, which was not included in here last year, but because we do have employees down there, we do have to break out that workers' comp. We have 6% increase in the property liability. We had two things taken off here, is repairs of stained glass windows. We did a few windows, we have a few more to go, but it's not included in the default budget. We are hopefully getting the fob system, security system installed within the next month. We've got an agreement that's come through, just getting the time to get everybody together to work on that. And this is one that's going to have to come out of here. The printer copier, we have a lease down there on a printer copier, so this is a case of the default budget's going to be dropped down. It will be included in the proposed. Special detail, there's actually a reduction because of the retirement calculation and a little bit of an increase on workers' comp. It's a $22 reduction. When I tried to do a percentage, it wasn't big enough.
To produce one.
Parking meters, this thing again has a slight increase in it. We have a change in the enhanced downtown parking loan that we did a few years ago. The principal and interest adjusts. We have workers' compensation that has a 3.5% increase. The overall total change is $768. It's a 1.41% increase.
That I might have a warrant article that will deal with the parking fund. it'd be interesting to get your thoughts on it too, is the debt service for the project behind the diner years ago to get rid of those buildings, is paid for out of here. And what that does is it limits the amount of revenue that can go into the parking fund, which is what we would specifically use to, put in lights or pave the parking lots. You can see they're in pretty bad shape, or to purchase land if it comes available. So recently we've had 2 opportunities. One was a barn behind what is now the archery, going to be the archery store. And we could have purchased that if we were positioned to do so, but we didn't have enough funds in there. And so what I would propose and be interested in your feedback is if we did a warrant article to remove this and put it under debt service, so that I believe it's $20,000 a year could then be put into the fund, because I can take parking funds and potentially at least double them with grant money, if not triple. So it's a good use of a good allocation. But,
More to come. More information to come.
Yeah.
Okay.
Are we ever gonna get into a conversation about raising the price of the parking meters? I think we probably got some of the lowest prices in the entire state.
Probably more than the entire state. That is going to be a conversation, I believe, that would come out of the parking commission, the select board appointed parking commission, so it's part of the study.
All right.
And we will bring that forward to the budget committee at some time.
I'll be in the hospital.
In fact, it might be a 4:30 when we do schedule and we talk about the parking commission. Yeah.
How much time, Karen?
Almost time, good.
Almost
I
time.
think we've got time enough for this one.
Yes.
Sewer users. In the default, we do have some adjustments that reflect different positions throughout the budget. We also have a reflection of adjustments in the health insurance changes, an increase in workers' comp, a contractual increase, which is something that needs to be adjusted in here, the reduction in data processing, the 6% increase in property liability insurance. Then we have some debt service increases. This is the biggest part of this budget that increased. And it all is related to the sub 5 area and the third of the river district loans that we have. The sub 5 area, the payment starts in 2019. So that has been included in here. And these are estimates. I'm waiting for an amortization statement. I got one prior to our Miller Street amount from last year, but I need to get an updated one. So these are my estimates of what payment and interest would be next year. So there is an increase of $195,150 in this budget. It's 23.11% increase. 176,000 of it is the sub 5 loan payment.
Right. Which is basically then moving to an increase in the sewer user fee.
Yes.
Yes.
So you've been presented the default budget. There are amendments to come on this. Next time, I would like to go over the proposed. And remember,
you do that for homework, or are you leaving that with us? Or you're
yes,
the next time?
I'm leaving this for you. I'm passing that way.
Try the staple, not staple.
There's no staples on these. It didn't work last time. And this has the default that you just were talked about. And then the proposed that has been reviewed by the selectmen. There was 2 suggestions by the selectmen to include in the proposed before I gave it to you, and it's been included in there.
If anybody needs a 3-ring binder, we save ones that people bring in the transfer station, so I have plenty if you want one.
Pass this way, and it's gonna write.
Karen, is this the same one that you gave me?
Yes, it is.
We want to pass this way. I think we just need to do it on this table. I just wanted to remind everybody again about next week's schedule. We do start meeting with the school But we also, Ralph, if we want to hear Ralph's report of the building committee on Monday. It's not a meeting per se for us, but it's an informational part of our, whole process here. So that will be, what, 5 o'clock?
Monday night, 5 o'clock in the Littleton High School cafeteria.
Okay, so we are still meeting, Tuesday is election day, right, next week? Okay, so we're still meeting regardless, 4 o'clock, so vote early or vote late, or don't do both. That's right. Okay, the school meetings are gonna be
Thursday
at 4, not 4:30.
It's 4. I actually called the school today to make sure.
Okay.
So it's 4 o'clock. The first meeting is going to be held at the SAU office in their conference room. And then the other 2 after that will be at the high school.
Cafeteria, most likely. Or music room.
On Thursday, so that
It
would
would be the 8th, the 15th, and then they skip the next week because it's Thanksgiving, and then it's, I think, the 29th or something like that. So,
Thank you.
anyways.
Okay, well, thank you all very much, thank you.
Thank you.
Thank you, Karen.